Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here. Today I'm going to talk about the vagus nerve and how to stimulate it through breath holding. But first, what does that even mean to stimulate the vagus nerve? Why do we want to do that? The vagus nerve is one of the cranial nerves. They call it the wandering nerve, and it innervates a lot of systems of the body, a lot of the organs of the body. And when it's activated, it enhances parasympathetic tone. So to use a car analogy, the stepping on a gas pedal is like our sympathetic side, whereas stepping on the brake, pumping the brakes, that's the parasympathetic side. That's the rest and digest system. So when the vagus nerve is stimulated, the body, the whole nervous system says, what systems do I need right now, and what systems should I downregulate, right? So, or think about it this way, if you're in a sympathetic state, what do you need? You need energy, right? Because you're about to fight or flight. What you don't need is things like digestion. That's why people get indigestion when they're in a sympathetic state, which, by the way, is why you should not be watching TV and eating food at the same time, because you are in a stimulated sympathetic state, and it's going to literally downregulate your digestion. So the vagus nerve is responsible for that parasympathetic state, and it's probably a good idea for most. Being too parasympathetic is rarely a problem. Most of us are in a sympathetic state way too chronically. In fact, a lot of autoimmune conditions arise from this dysregulation between these two systems. So seeking parasympathetic activity, probably a good idea for most. There's a lot of ways to do this, but I want to talk about specifically today breath holding, because it's free and it's easy. It's a little counterintuitive. You would think that holding your breath would put you into a sympathetic state, and at a certain point it does. If you do it for a while, it'll certainly do that. But your body has very sensitive CO2 receptors, or sensors really, and they reside mostly in the brainstem. The brainstem is what regulates your respiratory rate, which, by the way, I feel is a vital sign that a lot of rehab professionals don't look at enough. I think most people are over-breathing. You know, the textbooks say like 16 breaths per minute is a normal rate. I think that's actually too fast. A lot of breathwork specialists, yogis, kind of settle on 5 breaths per minute is kind of ideal. And by the way, another little metric to look at, especially if you have any kind of sleep tracker like an Oura Ring, look at your sleeping heart rate. That should be like below 15. If you're like 18 or higher, it's a sign that you're in a kind of a stressed state. Anyway, doing breath holds, it can stimulate the parasympathetic system and the vagus nerve in a number of ways. I'm not going to go through them all, but one of them is the mammalian dive reflex. So this dive reflex, it's a survival instinct or reflex. And what it does is when you are breathing slower, or you hold your breath, or when cold water hits your face, it basically reduces the oxygen demand to the heart, and it drops the heart rate by like 10 to 25%. So the idea is to conserve oxygen for your organs that absolutely need it. So this is, if you ever done a cold plunging, your hands and feet go cold or numb, that's because the body this is basically similar to this reflex. It's shunting the blood to your vital organs. It's like, okay, well, if we have to choose between the heart working or the hands working, we're going to choose the heart. So that's what it does, and that's why the periphery goes colder. So anyway, when you do hold your breath, it says, okay, let's slow it down. You know, for whatever reason, he's not getting enough oxygen in, and the CO2 is slowly rising. Let's slow everything down, and the parasympathetic system is activated. I'm always kind of fascinated how we can kind of use our biology in a quick and easy way to change things like our blood gases and change our state of mind. So anyways, how can we use this? So I think the easy way to do this is box breathing. Box breathing I've talked about a number of times on the podcast. It's really easy to do. There's a lot of different applications for it, a lot of different benefits from it. But that's typical is a 4-4-4-4. That's the box. So it's a 4-second inhale, 4-second breath hold, 4-second exhale, and then another 4-second breath hold and repeat. And this can be a little harder than it sounds, honestly. You do like 3 to 5 rounds of it, and you're going to be like, okay, I'm getting short of breath. Especially if you pair it with movement. So I like to do a lot of box breathing with walking. So if you assume that every step is roughly a second, you do 4 steps inhale, 4 steps hold, 4 steps exhale, 4 steps hold. But I will use that more if I'm trying to improve my tolerance to CO2. If I wanted to use this to stimulate the parasympathetic nervous system, I'd probably just do it in a seated position. Oh, and by the way, please do not practice this driving. I hear a lot of people tell me that they do their breath work while driving. This is a terrible idea. You can pass out. It doesn't happen often, but it can happen. Worst place to do it, that or like a frozen lake. Don't do it there either. Do it in a controlled environment. Do it. Assume that you might pass out, which it probably won't happen, but if you do, you want to be able to land on the floor. So do it sitting, or laying down is probably even better. Do it in bed. That's probably the best bet. So when would you, or why would you use it? So say you are very stressed. Maybe you're feeling very anxious. Maybe you just got in a fight with your spouse or a loved one or something like that. Spend 30 seconds working on that, and that will quickly alter your nervous system from sympathetic to parasympathetic. If you have to give a presentation, you don't like giving presentations, you're nervous, maybe do a little bit of box breathing prior to it. Or even if you're just feeling stiff, like the muscles have increased tone. Well, guess what increases the tone of your muscles? Your nervous system. When you're in a sympathetic state, it's getting ready to fight or run, so it increases the tone of the musculature. So if you're having an achy muscle, just slow the breath down or do box breathing. Work on some simple breath holding. Don't go overboard, because you go too far, you will go into sympathetic. And you'll be surprised at what that can do. I mean, a lot of times people come to see me for back pain, like an acute flare-up of back pain. Maybe the QL muscle is just in chronic tone, or spasm, some would say. And I'll just have them work on breathing for a few minutes, and that quickly quiets down the system and reduces the tone of the muscle. And it's breathing. Nothing's bad is going to happen. Even if they just fracture a vertebrae, they're not going to do anything just by breathing. And if you want to get fancy, this is kind of interesting. Each nostril is paired to a part of the nervous system. So the left nostril is associated with the parasympathetic side of the nervous system, and then the right nostril is paired with the sympathetic state. So another little hack is you can just take your thumb and close your right nostril and breathe out of the left nostril only, and theoretically that will increase parasympathetic activity. And I don't see why you couldn't just pair that with the box breathing. So maybe left nostril breathing during box breathing if you really want to get fancy. Again, don't go overboard. There's the way the body works is more of something doesn't always mean better. Usually there's a sort of J-shaped curve to things where some is good and too much is bad. It definitely applies here. So there you have it, something free and easy to do when you're stressed or feeling anxious or just feeling a lot of muscular stiffness. Try doing some breath holding and see what happens. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.